Well, again, welcome, welcome. Thank you so much for being here, for being a part of this Voices of Vasculitis Patient Recommendations Report review. My name is Jocelyn Cooper, and I welcome you on behalf of the Black Women's Health Imperative, as well as its signature program, the Rare Disease Diversity Coalition. So we're so excited to have you here with us tonight as we prepare to share all of this great information and insight on the great report that we've just worked on. Lots of great and hard work went into this project. And so we have lots of phenomenal patient advocates, physician advocates, as well as you, our guests and audience here with us tonight to review this information and engage with us. So just a few housekeeping rules before we get started. Please keep yourselves on mute unless you're speaking into the space once the invitation is open towards the end. But feel free to utilize the chat throughout the presentation. We want audience engagement. We're going to prompt you with questions to get you to thinking and give great responses to what we'll pose to you all later on. And so we're excited to just have everyone involved and engaged in the conversation. This is a community discussion webinar. And so we're excited to have you here with us on this evening or on today, depending on your time zone. All right. Okay. So first, we would just want to start off by thanking Amgen for being our generous sponsor on this particular project. We could not have done this work without you. And we also want to thank our great partners at the Vasculitis Foundation. So excited to have them with us here tonight by way of their representative. And we're super excited to just welcome each and every member, whether they're on the panel tonight, the invaluable work that was done by each and every member of the Vasculitis Health Equity Committee. It was super helpful to have your direct insight and appreciate your lived experience. And we're so grateful that you contributed to this work. And we're glad to have you, each and every one of you, with us as we keep moving this cause forward. So just a quick insight into who we are and who our organization is on tonight. Again, we are the Rare Disease Diversity Coalition, a signature program of the Black Women's Health Imperative. And we launched in May of 2020, RDDC, in an effort to elevate the health equity component around the rare disease space. So we are unique in that we are a signature program that doesn't just focus on those that are Black and identify as women, but we also focus on other minoritized communities. So for us, that means the rare within rare. And the rare within rare qualify as these great populations that you see here. We work on advancing equity for these audiences. So if individuals identify as BIPOC or Black and Indigenous, Latinx, Asian communities, or Pacific Islander, people living with disabilities, rural audiences, and population. So please know that we see diversity as something bigger than race or ethnicity, though those are definitely important factors. We absolutely honor everyone that is in the diverse space from equity standpoint, because we know that it's important that all of these voices are elevated and highlighted in the rare disease space. So why you're here tonight? You're here tonight to discuss this phenomenal project that individuals have worked so hard on. And so we pride ourselves at RDDC at being one that centers the patient voice, centers the caregiver voice, because we know that we could not do this work without them, but also that it's important that those voices are centered because they are the true lived experts in this work that we do each and every day. You cannot get insight into a process without talking to individuals that are living in that space in and out. And so that's what we're here to do tonight as we give kudos again to our sponsor, Amgen, our partners, Vasculitis Foundation, and Links to Equity for bringing us all together by way of the Vasculitis Health Equity Steering Committee to get this work done. So this is about a 20-page report, and that's why we wanted to give you some highlights and some talking points tonight as we hear directly from some of the patients that have contributed to this project. So you may be asking, who are these phenomenal people that I see? So the first person that we want to highlight is Dr. McKinnon as an associate professor at the Medical University of South Carolina, the Division of Rheumatology and Immunology. She focuses on comprehensive care to patients with vasculitis, granting them access to cutting edge treatments while fostering advancements in research within the field. So she has a phenomenal interdisciplinary approach. It's groundbreaking vasculitis work in a clinic. And she highlights that partnerships in clinical health trials aim to provide better quality for all patients. So we're excited to have Dr. McKinnon here as a physician advocate that specializes in vasculitis with us on today. The first patient advocate that I like to highlight that you see is Miss Molly. And so we like to share that Miss Molly is a phenomenal advocate that has great insight into what it's like not just to be a patient living with vasculitis, but also working in the healthcare space. And so Miss Molly's going to give us great context on what she knows as someone recently diagnosed, but also as someone that works in healthcare. So we welcome Miss Molly. Our
Hi.
next, our next panelist is Kimberly Fisher. She's a Delaware native, an ordained minister, and a healthcare professional with over 25 years of experience in nursing and holistic health. So, Ms. Kimberly is the owner of KF Health Consults. She partners with communities in her area to deliver integrative wellness services. So, she personally manages all of this content and is also a multi published author, award recipient, and ambassador. So, Kimberly continues to empower others to live purposely and thrive in faith and wellness. Welcome, Kimberly. All right. And so the next person that we'll highlight that's on tonight's panel is Miss Emily. We're so excited to have you with us tonight as the representative for the Vasculitis Foundation. So Miss Emily serves as the Chief Development Officer for the Vasculitis Foundation, but also as an advocate who loves sharing insight into this space and is going to give us some great content about vasculitis and the work that they do at the Vasculitis Foundation today. All right. And last but certainly not least, we like to highlight Caleb as a patient advocate. So Caleb is with us and was diagnosed with GPA in July of 2024. Upon diagnosis, he lived in Somerville, South Carolina, but later moved back to Grand Rapids, Michigan area to be closer to family. He works in the medical devices industry and has a passion for improving patient outcomes through both his professional and advocacy work. Um, he joined a gathering of young adults living with vasculitis while in Nashville, Tennessee. He is passionate about empowering patients to be strong self-advocates and ensuring that young adults with vasculitis have a seat at the table in conversations about care and support. So we are so excited to have each and every one of our advocates here with us tonight to elevate this conversation, to elevate this community discussion. We encourage you to drop in the chat now where you're joining us from so we can get a lay of the land in terms of where everyone is. So as we prepare to move forward, we first want to start off with a quick question that just gives us deeper insight into what's happening because we always get new information regarding rare diseases. We know that there's over 10,000 conditions and things are constantly changing, especially with the advancements of technology, right? So we want to hear from our experts, again, professional and lived. We want to hear from our experts today. And we're going to start with Miss Emily providing us great insight into what is exactly vasculitis.
Thank you, Jocelyn. I'm so happy to be here. So, vasculitis is a rare condition that represents a unique group of nearly 20 diseases characterized by inflammation of the blood vessels. So, that inflammation can restrict blood flow and cause vital damage to organs. Examples being your lungs, your kidneys, your heart, brain, skin, nerves, and joints. And so, one of the greatest challenges with vasculitis is its diagnostic complexity. So because symptoms often overlap with more common conditions such as sinus infections, fatigue, vision loss, pain, rashes, so patients can bounce between primary care physicians, ERs, specialists with one symptom being treated only to have another one arise in its place. So this makes early and accurate diagnosis particularly challenging and often requiring expertise from multiple specialists, including rheumatologists, pulmonologists, nephrologists, neurologists, and others before they can really get an accurate diagnosis.
Thanks so much for that overview, Emily. This gives us a good preliminary starting place to kind of gain insight into what vasculitis is and how it can be viewed moving forward. So we want to check in with our patient advocates and say, can each of you share what your diagnostic journey was like? We'll start with Kimberly, and then Caleb, and then Molly.
Thank you so much, Jocelyn, and welcome everyone. We're just so glad that you're here. And again, I'm so thankful for this particular committee and the rare disease and vasculitis coming together to give us a space. My journey is very complex, but I will give you the short word version. About now 16 years ago, I, started having a lot of migraines, but at the time we didn't know exactly what type of migraines because they were mimicking strokes like symptoms. I was having a lot of oral lesions in my mouth at the time, and I was also having some visual problems. However, I didn't know that they were linked. The most thing that stood out at that time was the fact that I was having all these migraines that were causing me to not only have the stroke-like symptoms, but it was messing with my ability to walk. So I was seen in the hospital for I don't know how many times, probably a month, maybe 2 or 3 times a month. I was at the hospital. I was followed by initially my primary care and a neurologist, but still nobody knew all of what was going on and that it was connected. So to make a long story short, I actually have been was diagnosed and being properly treated after all of that time. It's only been 7 years. So you can imagine what I have been going through. I was misdiagnosed probably 5 times that I can think off the top of my head with major conditions such as multiple sclerosis, lupus, even herpes. And so it's been a long journey. Once they found out what was wrong, because there wasn't a lot of doctors that knew what was going on, I still had to get on the right treatment. So I seen over 20 doctors, different specialists. And so it's been a long journey for me. Finally, just like I said, 7 years ago, I finally was connected with the right doctors who were able to come together and treat me properly. Still today, it's very challenging for me because it literally has affected every Behçet's that I was diagnosed with. That's the rare condition. Um, it literally affects my whole entire system. Every vein and artery has been attacked in my body. So I have actually had a mini stroke and a mini heart attack over the years. I still have problems when I have flare-ups with walking and talking at times. And I'm treated every month with infusions and also Botox injections, which we'll talk more about, getting in depth with some questions. But I still have to take maintenance meds every day. So it's a lot involved when you have the rare conditions, the vasculitises in particularly, because they affect literally every part of your body. The worst thing is the fact that it's not a lot of people who know about these rare conditions. So it was very hard for me to be treated and also to be approved. So I don't want to tell everything. So I'm going to pass it along to one of my counterparts. But I'm just so thankful that I finally am able to connect with everyone and we're able to get this information out to you today. But I'm just so glad that you're all here and we're looking forward to helping you further. Thank you.
Thanks, Kimberly. You're a hard act to follow, but I'll try my best. My name's Caleb. I have GPA, as Jocelyn had mentioned. So my journey to diagnosis mainly started with some ENT visits. I had a lot of sinus issues like sinus infection. We thought there were sinus infections. And so I had several visits to the ENT. We tried several different medications, nasal sprays. When we thought it was sinus infections, I was put on some antibiotics and some steroids. And every time, because of the steroids that I was put on those, that double dose, I would feel better. And so a couple of weeks after I got off of that medicine regimen, my symptoms would start to come back. And so finally, after several months of ENT visits and I wouldn't say misdiagnosis, but kind of throwing, throwing something at the wall to see if it would stick, so to say. They at first thought it was sinus infections, and then we moved on to allergies. And then finally, my doctor ordered a blood test, and it was the ANCA blood test, and it showed high levels of inflammation for me. And so that's how I finally reached diagnosis. So my journey was quite shorter than many people with vasculitis. I was diagnosed in less than a year, which is, pretty short in the grand scheme of things. And my disease mainly affects my sinuses and my ears, so I don't have kidney or lung involvement. But we were able to get on, or I was able to get on infusions or rituximab infusions, and feeling a lot better now. So happy to be here and talk about my journey some more later.
Thanks for sharing, Caleb. Molly?
I am so sorry about that. I don't know what just happened.
No problem.
Tech problem. So I apologize. Hi, my name is Molly. I live in Tulsa, Oklahoma, but I'm originally from Durham, North Carolina. And I was diagnosed with GPA, granulomatosis with polyangiitis in September of 2024. So it's been about a year since I've been diagnosed. And similar to Caleb, my diagnostic process actually was not that long. But looking back at all of these weird symptoms that I had throughout my life, random outbreaks of hives, angioedema, horrible migraines, which they would cause me to pass out, almost seizure-like kind of symptoms with the migraines too. And so looking back, things were starting to make sense now that I had the diagnosis. So what spawned me looking further into it was I had an enlarged lymph node on my neck. And typically if that's, some sort of illness or whatever, I would take antibiotics, it would go away, but it was there for several months, about 3 to 4 months. And it was getting larger and kind of tender. And so I was like, well, this definitely isn't normal. So I went and saw my PCP. Again, I was put on antibiotics, thinking it was infection, and it didn't go away. And then I went to an ENT. They did like I guess like an ultrasound, and they said, we don't know, everything's fine. I was like, well, everything's not really fine, because I felt like I had the flu constantly. My whole body hurt all the time, and I just felt really awful. But I kept just pushing through. And I think for a lot of us, that's part of the journey, is just feeling a little bit invisible, and nobody really understands how you're actually feeling. And so you just kind of try to put on this act of, I'm fine, everything's fine. Anyway, so I eventually got to see an oncologist, because I pushed for a biopsy, and my PCP did as well. So I got a biopsy done. They didn't get enough tissue to fully diagnose, but the oncologist was pretty certain it was an autoimmune illness. She ran a panel of tons of blood tests, and then I wasn't ANCA positive, but I was I had elevated CRP levels. And so she referred me to a rheumatologist, and then she did another panel of blood work and found that I had vasculitis. My vasculitis, the GPA, is primarily with kidney involvement. I don't have a lot of the sinus stuff and respiratory problems as other people do. So I have a lot of kidney infections, a lot of UTIs. I've been hospitalized for, I think I had 4 kidney infections at one time. Right now I take Cellcept, which is it's used off label for vasculitis patients, but it's typically for people who have just had a transplant. So it just like blocks your immune system from rejecting a new organ. But, you know, in this case, it's, you know, just lowering it. So I'm lowering the inflammation in my blood vessels. So I take that, and I also have rituximab infusions every 6 months. So yeah, I guess that's about it. And I'm really glad to be here. I'm so glad to be connected with you guys. It's been a huge part of my journey. I don't know what I would do otherwise if I didn't have people to talk to about this. So I will pass it on to the next person.
No, thank you so much for being here, and for highlighting that, Molly, Caleb, and Kimberly. The great thing that we see about your journeys is that 3 different individuals, in some ways the same diagnosis, but very different because of the different types of vasculitis. So we turn to our physician advocate that's with us tonight, Dr. McKinnon, to just ask, Dr. McKinnon, based on your experience and, you know, some of the insight from your colleagues, why can vasculitis be so challenging to diagnose, you know, in the rare disease space?
Well, I think that you look at medicine as a science of pattern recognition. So as you go through your training, you learn about different diseases. You spend weeks learning about the cardiovascular system, weeks learning about the kidneys, learning about how things fit together to suggest a certain diagnosis. For example, chest pain, sweating, pain radiating down the left arm, people think about a heart attack. But in medical school, I remember spending 2 days on rheumatologic diseases. And that's not 2 days on all the vasculitic conditions, but 2 days on all the rheumatologic diseases. So you imagine vasculitis gets a very small part of that. And then you go through your medical school training and internship. And rheumatology is actually an elective rotation, meaning that you don't have to take additional training in rheumatology to become certified to go into internal medicine or family practice or the other specialties. So you may end up going through your training with very, very little exposure to these diseases. And these diseases are rare. So, how do you recognize a pattern if you don't see it as a medical student, if you rarely see it in the hospital? And then, as you've heard the stories tonight, vasculitis doesn't present the same in everybody. Its fingerprint is individual, like every patient. So it may be one patient who comes in living in a place like South Carolina that's full of pollen and allergies with chronic sinus symptoms. So other things are more common than vasculitis, and certainly those are the other things that physicians think of first. And then I would say the other thing is that as a medical community, we're not always great about communicating with each other, especially if we come through different medical systems. You could be in Charleston where I am, and there could be 4 or 5 different systems. And if you see a doctor in one system and they don't happen to talk to the doctor in the other system where they send the patient may have to just start all over again. In some cases, I'm very lucky, and I get the phone call from the ear, nose, and throat doctor who calls me and says, "I think this patient has GPA. Can you see them sooner?" In other cases, and I can think of a gentleman I saw recently who just had a routine referral put in for possible vasculitis from a pulmonologist who had seen that he was bleeding in the lungs. So I think there are a lot of different factors, but I think the lack of training, it's just not uniform, and not all physicians see a lot of vasculitis as they're becoming doctors, and the rarity of the diseases make it more challenging.
Thank you for highlighting that, Dr. McKinnon. Just as you said, just as varied as we have the individuals that are here with us tonight, we have that many different presentations of the condition. And so to highlight another key piece that Dr. McKinnon said, it's centered around the fact that there's limited training on rare diseases as a whole when someone is medical school. So this is why we know learning to advocate for yourself and also increase partnership with your provider is one of the recommendations we'll talk about later, but also looking at the entire care team and having understanding to some degree, a bit of grace, right? As we're connecting with individuals, knowing that there's so much going on with the brain, body, that it's super important that we have ongoing conversations about what's happening with us as we move forward in diagnosis, but also in treatment care and support. So I'll highlight very quickly, just to recap some of the great things that our friends have already shared on the panel, which is the reality of living with vasculitis. This is some key information that we called out in our discussion, in our report, and it talks about how there are nearly 20 distinct types of vasculitis. You know, on average, it's an $8,000 plus annual cost for medications. And that because of the limited access to specialists and things of that nature, most individuals have to travel 90 plus minute travel times for care. And so that's something to think about when we talk about rare diseases as a whole and engaging in this. 3 months or plus, 3 or more wait times for appointments. And so that's something that individuals are dealing with. And because of additional financial costs and barriers, individuals may often have to take a look at utilizing different financial measures to get assistance to go to appointments and things of that nature. So it taps you out financially where it's like, oh, I don't have a lot in savings because money I did have now it has to go towards my health care. And so that's something for us to think about as we move the conversation forward. It was a great quote that's in our content in the report that was offered by one of the patients' experience where it's like it feels like whack-a-mole because as they said, you're treating one system and one symptom and you're getting through one phase of things and then financially something pops up and then you just don't feel heard. And so we wanted to highlight the reality. Now we'll go into some of the barriers as we move forward with some of the conversation. This is not new when we talk about the rare disease space, challenges in healthcare as a whole, especially when health equity and diverse communities are mentioned. So we'll talk about the fact that we all know that at times that feeling unheard can come from certain components of bias or stigma. It also could just be individuals not knowing, right? The providers, other members of the care team just not being aware or knowledgeable. But long wait times can definitely be barriers to care. High out-of-pocket costs, insurance red tape. We all know about that favorite word, prior authorization, that phrase, and how that often takes time in terms of just making sure that we get access to the right treatment, to the right medication. Someone living in a rural community can make a huge difference, of course, you know, in this type of setting. And then there being gaps with telehealth is a key thing. So I want our audience to get involved with us because we know that your story matters too. And so we want you to drop in the chat just one word that describes how you feel after hearing these challenges. We want to honor your feelings tonight because we know that whether it's vasculitis or another rare condition or chronic illness, because the truth is individuals are often diagnosed with more than one rare condition or other autoimmune conditions as a result of their rare condition. But we absolutely want to make sure that we highlight and honor what you're saying because your frustration is valid with the process. And so we're hopefully here to help you learn tonight to advocate for yourself, to get deeper insight into what you can do as a whole to advocate, but also just in general, you know, what it feels like to be you and be in your shoes. So for you and your family members, we see the words defeated in the chat, frustration, tired, because we know that these barriers are real. And so we just want to acknowledge and honor that tonight. Thank you all so much for engaging in the chat. More questions and check-ins to come. So really quickly, we have a great question for our patient advocates that are experts on our panel tonight. How have you had to advocate for yourself to ensure that your concerns were heard? So this time we'll start with Molly.
Okay. So wow. It's kind of a broad question. I think I can speak for a lot of us when I say I need like a a personal secretary to handle all of the phone calls that I need to make, all of the setting up appointments, making sure that my medication gets filled on time, that it works, managing all the side effects. I literally, and I'm also in the midst of applying for SSDI. I was laid off over a year ago. I switched from full-time to part-time, and then it just was not sustainable anymore. And I worked in medical coding and billing and accounts receivable. And I've been doing that as a career for about 10 years. And I just couldn't, my body wouldn't allow it anymore. So I lost my job. I started to apply for a disability. And that is an uphill battle in and of itself. I'm sure you guys are aware of that. I'm in the final process of waiting for to be actually heard by an actual judge. So I get to tell my story and not just fill out these forms that probably nobody even really looks at, it seems. So basically, I do have an advantage in that I do understand how the system works. I think part of the problem is that patients don't understand insurance. And I think that that's in a lot of cases, they do that on purpose so that you can't advocate for yourself. You don't know, you pay your premiums every month and you pay your co-pays and you know about a deductible, but past that, really, you don't have a whole lot of information to go on. So you're at the mercy of this, monolith, medical monolith that's, really, really hard to navigate. So I did have an advantage in that sense that I understood the way things work, but it was also very frustrating for me because I couldn't just do it myself. And I was relying on people that weren't doing their jobs properly. And that's frustrating for me. Also, I realized that I have probably a problem with control. I might be more of a control freak than I realized. So I'm learning a lot about myself through this whole process. But advocation is, participating in stuff like this is so important. And the support groups through the Vasculitis Foundation, if I hadn't found them, I would be completely lost. So, participating in things like this have helped me find a purpose, turning my pain into purpose. That's what I try to do, reaching out to other people who suffer from this, because it is so hard for others to understand what this is like. It changes your life completely in every way possible. And financially, I'm sorry, I'm talking too long, but I do want to mention I have expanded Medicaid in Oklahoma for an adult with no dependents, and I'm not technically disabled yet. So I'm so grateful to have that. And I've had it for about 2 years, but it's looking like that might go away sometime soon. If that happens, I have no access to care. And even if I do get awarded disability, that's not a living wage. I still need assistance. So it is a huge, I try not to worry about it too much because I don't have any control over what happens, but I do have faith and I do have hope that you know, I have a support system, people who care, and I do believe that this will all come out for the greater good. If I didn't have that, if I don't keep that mindset, then it's, you know, you can fall into a deep hole of, you know, depression. Mental health is a huge thing too that goes along with this that you have to manage. So
Sure.
anyway, I'll stop blathering on, but that's
No, thank you for highlighting all of that, Molly, because it's some of the content that we're going to get into towards the end of our presentation shortly. So I just want to kick it to Kimberly for her to highlight what are some of the ways, just highlight one or two ways that you've advocated for yourself. And I'm sure there's probably going to be some overlap with all three of you in terms of different ways that you've advocated.
Certainly. Thank you, Jocelyn. Um, I am a big advocator. I've had to advocate for myself, as you already have heard. Can you hear me?
Yes.
Okay, great. I've had to advocate a little bit longer than Molly and Caleb. And so for me, it has been very helpful, like Molly said, because I had the advantage because I've been a nurse for over, 20 some years when I was diagnosed and even started having problems. So I already knew some things in that role. But for me personally, I have had to actually, I was hoping that I wouldn't have to pull that nurse card, but for me, I had to go outside the box. A lot of the providers, they weren't trying to really hear or connect what was going on. I kept having barriers where there were people who were saying, "Oh, here she comes again." There was a whole lot of things that I was dealing with all those years that I kept going back and forth to the hospital. And so I was finding out even in the doctor's offices that I was being labeled. So I had to learn how to say, to just block out that noise. Part of advocating for yourself is just staying focused on, whatever that issue is that you're having. I'm saying that because everybody here probably is dealing with something different. But for me, I had to say, you know what? I know what I'm feeling and I have to get better. So I'm going to keep on telling somebody until somebody listens. So for me, I had to advocate by just keep being that sounding that alarm. No matter how many times I was being blocked, I had to keep on going to the next person. So sometimes for me that meant I want to speak to the manager of this clinic, or I want to speak to the nurse manager of this unit. And I had to do that a lot of times. I've had to advocate for myself by even going up against the whole hospital system. Yes, I did. And so for me, it was just using my voice. The other part of my avocation, even today, is, and I believe this is where the strength is using any platform that will have me. So I write. That's part of my advocating. I write about what's going on with me. And even I use that experience of, and I'm so glad, I love Dr. Kathy, I'm going to call her for right now. I'm sorry if I'm saying your name wrong, but I love her because not a lot of doctors are going to own up to this. And I was guilty of this. And I wrote this in one of my nursing association letters that goes out. Sometimes we get stuck in a rut when we are providers and we become numb. And so I was one of those people. So I remember that. So part of my avocation now is I remind my colleagues, listen, if the person says they're in pain, they're in pain. So we have to treat them different each time. So part of my advocating is I'm educating, but I'm also still, when I've got a problem, because I still run up against new staff or providers leave and I get another provider, I have to remind them, hey, if you don't know what Behçet's is, here I bring in the literature myself. And I educate them until someone's going to listen. When I get denied of something because the insurance company has now changed systems, part of my advocating is getting on that phone and saying, listen, I need for you to talk, this medical director, do they know what vasculitis is? Do they know what Behçet's is? And I keep on pushing. So I know that sounds kind of pushy and hard, but when it's your life at stake, I that's what I do. I educate, I raise awareness. I also advocate. A lot of people are like, why do you have those colors on? If you could see me right now, I'm wearing purple and red. I mean, purple and blue.
And I use all of that. I learned that these are ways you can advocate, because somebody's going to ask you, what is that color for? What are those letters for? And that's my way to say, this is what it's for and what I'm advocating for. So, I probably said too much. I didn't want to overlap what Molly was saying, because I do a lot of that. And yes, I am in Washington and I get with my legislators as well.
No, thank you for sharing that, Kimberly. Caleb, besides being a part of this phenomenal steering committee, please share or highlight one or two things that you've done to advocate, because we know there's lots of things down the line, but we know that everyone's advocacy looks different. So feel free to share.
Yes, and you have to stop making me go after Kimberly, because I keep saying she's a hard act to follow. No, but I would echo a lot of what they said, and I think I'll hit on something a little bit different. I think it's really important to ask your care providers to communicate with each other. And as we mentioned, vasculitis affects many systems, and so Dr. McKinnon was actually my rheumatologist when I was diagnosed, and one thing that she was very intentional about was communicating directly with my ENT. Behind the scenes. And that makes it a lot easier on the patient. And even if your doctor isn't intentionally doing that themselves, I would say don't be afraid to ask them to communicate with your other doctors. You may have to take the steps to get them in touch, like provide them the information of the other doctor, but that would be one of the points I would add on top of what Molly and Kimberly said, is just ask your providers to speak with each other, because sometimes they could be in different systems, like Dr. McKinnon said. There could be 4 different hospital systems in the area, and maybe they're in different systems and it's not as easy for them to see your information. So don't be afraid to ask them to communicate, because if they tell you no, then you got to advocate for yourself a little more, but it's very rare that they would say, no, I'm not going to do that. So that would be my advice.
Thank you so much, Caleb, for highlighting that. Sometimes the providers, a lot of times, I'm sure Dr. McKinnon would say the providers are taxed. They have a lot of patients coming in for different things, particularly if you're a specialist and you're in a more rural area or even a major city. It's still limitations, right? In terms of number of patients can see, those wait times that we talked about earlier. So it does require you sometimes as the patient, and your support system or village. So your care team, your family support system, whether chosen or family of origin, what that looks like is having conversations, following up, not just with the provider, but the care coordinators and other individuals involved in the care team to make sure that you're getting all the service that you need. One of the key things is just making sure that we don't assume that the doctors are going to do everything, but having conversations with them, because it is absolutely a partnership. So we got a great follow-up question for Dr. McKinnon here. What can providers do? What do you encourage providers to do to reduce barriers, especially in like rural communities, more underserved communities? What are your thoughts?
Well, that's a great question, and that's one that I've been dealing with since I moved to South Carolina about 3 years ago. My vasculitis practices before were in major urban areas where there were other surrounding large centers, and here in South Carolina, where I'm at the medical university, is the primary tertiary care. So we have a big state that has a lot of patients that don't have access to care, and we've had this discussions about patients we saw who are transferred in from 4 or 5 hours away, who just tell us when it's time to go back home, I don't have any way to get to you. So we've been working with the Vasculitis Foundation and with some of our local groups to figure out what kind of outreaches can happen. And these are some of the things that we've started to work on locally. Obviously, telehealth has been a boon, but I think we have to be a little bit more flexible about how we think about telehealth. And what I've been doing with some of my patients who live far out, who can't come regularly, is working with their primary care to have joint telehealth visits where their primary care can give me input into what's going on. We can talk about how the patient is doing and things that we can do together to help manage the patient at home if they can't come to the centers. Very lucky because we are developing a much broader network in the state with immediate stroke recognition services. So we can just kind of piggyback onto that and use some of the roads that have already been developed to get vasculitis care out to our rural communities. Some of the other things we've talked about with the Vasculitis Foundation and Amgen, who's a sponsor for this, is also working with us on is kind of a phone a friend for rheumatologists who specialize in this disease, to be accessible to rheumatologists outside of the major medical centers who may not have seen it or see it and recognize it, but are not sure about how to manage it. So making ourselves visible to them, making ourselves accessible to them. So when they have those questions, they have somebody they can call to get advice or to get help. And then the other thing I think that we're really focusing on, as part of this approach, is education in the community. Again, it's pattern recognition. If you don't know what to look for, you're not going to see the disease. So the kidney doctors who are in the community, the rheumatologists in the community who may not see this disease, general practice, what are red flags that should kind of put up the smoke signal for vasculitis? For example, when we talk to ear, nose, and throat doctors, we say that patient who has ear infections as an adult, who keeps coming back, who immunologically otherwise is normal, you should think about GPA. Somebody who has chronic sinus disease, who gets better with steroids, might think about GPA. So these are kind of the things that we're looking at and trying to get out to our rural communities to help.
Thank you, Dr. McKinnon. Those were great insights. And so that really leans into the next portion of our topic, because we will start talking about what it's like for several of our friends in the chat have said, like, hey, how do I show up? I'm curious to know how I show up. How do I provide support? And so we want to highlight that uh, you as a potential caregiver, as well as a patient living with this, holding space for rare warriors is a significant thing. Burnout is real. And so we really want to highlight the mental health component for just a moment, because this is one of the key recommendations that our awesome patient advocates came up with as it relates to this report. You cannot ignore the mental health component attached to living with a rare condition or chronic illness. It's super important for everyone to consider that and to be mindful when you're engaging or interactive. It requires a different level of grace and patience and understanding, and a lot of listening, a lot of conversation, a lot of asking questions and not making assumptions, because we all, if we're honest, see things through the filter of our own experiences, right? So if we're not living rare or living with an autoimmune condition, we don't have the same level of understanding. So it's super important for individuals to just understand, like, it's totally okay if I have to ask more questions and not feel like I'm invading. But ultimately know that even if you serve as a caregiver or support team member for someone that's living rare, it's not about just the task that you're completing. Ultimately, it's about connection. And we're going to get into that component next as we talk about that emotional and mental health, because I want to highlight one of the key things that came up repeatedly during our steering committee meetings is that, something being available doesn't mean it's accessible. And so it's super important to understand that mental health access isn't always equitable depending on where someone lives, also just depending on cultural considerations based on someone's faith, their family culture or history. It's a lot of components that go into it. But what we need to do more than anything overall is normalize exhaustion as a component. So I'm just going to chime this question for time's sake to one of our patient advocates and ask, how can living rare challenge an individual's mental health and that of their village? So I'm going to pose that question to Kimberly. How do you believe, based on not even just your experience as a patient living with vasculitis and Behçet's in particular, but being someone that works also in ministry in a faith-based setting and a medical and healthcare setting as a nurse, how have you seen someone living rare be challenged from a perspective of mental health?
There are several challenges, but in particular, especially I'm going to say in communities where there are a lot of people of different colors, and then also when you have that faith-based component in it, the mental challenge is when you're feeling those feelings of isolation. I'm going to say that you can feel isolated, and certainly depression is in there, but you feel isolated because culturally, you're told you're not supposed to have these feelings. That you're weak. It's a sign of weakness if you show any of that. Also, in the church or a religious realm, I'm going to put it that way. A lot of times we don't, whether it's dealing with a rare disease or I'm just going to say somebody that keeps having miscarriages or things like that. we're taught that maybe you're not walking in enough faith, so you're not seeking that mental health provider or counseling that you need, when everybody needs it at a time. It doesn't mean you're crazy, but it's certainly something that I know, me, when I was going through this, it was a barrier for me. I didn't want to get any help, but the truth is I felt alone. I felt isolated. I needed to connect with someone, and I didn't have that. And instead, I felt like I couldn't talk about it. So, these are real issues, and they do affect you mentally, to the point you're depressed. Sometimes you can even get suicidal. Well, what's the use? Nobody's listening. Nobody cares. I'm going through this alone. Nobody even knows what's going on with me. So, it's a challenge because you don't want to admit that this is a weakness, number one. So I'm not sure about other communities, but I know the communities that I work with and that I grew up in, and then you put church on top of it, those are real issues.
No, thank you for highlighting that. It's so true. It's so true. People often talk about the component of, we had some great friends share in the chat, things like people saying you should just pray more, walk in
Exactly.
faith more. And really, that is a form of re-traumatization, especially when you've already experienced to some degree medical trauma, just trying to navigate getting to diagnosis or getting the appropriate treatment and care and support even after diagnosis. So I'm going to lean the next question to our friend because she already shared some insight about her participation and how much it meant to her on her journey. Miss Molly, please share, how have support groups and peer networks in the vasculitis space help you feel seen and heard?
Well, I mean, like Kimberly was saying, you do start to feel really isolated because people can't understand what you're going through. And it's not their fault. My friends, I think in some sense they felt helpless because they did want to help, but they had no idea how. And I had no idea how they could either. I didn't know, I need help with this, let alone the stigma of asking for help. Not just pushing through and doing it on my own, which is how I grew up, pretty much. So, fighting past that barrier, knowing when it's okay to ask for help, that is when when I found Vasculitis Foundation and I started going to those support groups, it changed everything for me because I got information that I never would have gotten had I not, been present in that particular support group. References, doctors, things I can seek out to help with the treatment process, but also just having someone who completely understands what you're going through and listens, and that compassion and care is it's fundamental because the loneliness, the isolation is debilitating at times. Even when you do have people around you who care, it it's just so hard to explain this boulder you're pushing up a hill. It's really difficult. And so I come from a background, I'm a recovering alcoholic. I have been to AA. I was involved in AA for a long time, and so I I see the connections, and I was like, I'm like, well, only someone who deals with this can really help another person who deals with this. So yeah, it's the having that connection between the two has really helped me as well. But
Yeah, thank you for sharing that, Molly. And thank you for your vulnerability and transparency to share your
mhm,
other recovery journey, right? Because it's all a healing and recovery journey as a
exactly.
whole. It makes a huge difference when you talk to someone that just gets it. I don't have to explain all the details of why I'm here. You know that we're all here together because we have this commonality, this common goal in mind. And that's why peer support networks are so important and so powerful because it's easier, as one of our friends said, it's easier to just, like ask for help when you're talking to someone instead of having to explain the basics. And so that's why peer support networks are so powerful. And so we're so grateful for our friends at the Vasculitis Foundation having those networks set up to be a source of strength for individuals living with vasculitis, because it does make a huge difference. So, we've highlighted throughout most of the presentation some of the challenges and highlighted the personal journeys of our advocates here. And now we're going to get into some core pieces of our report that highlights the patient recommendations from both a systemic level and in terms of what can the patients and the caregivers or support team do. So we're going to start with censoring equity in all protocols, making sure that the recommendations are in alignment with equity from a place of it's ingrained in our policies and in our programming. So whether this is in a clinical setting or in something involving treatment or care, it really is important that the equity component is normalized, meaning that we are automatically thinking about censoring diverse audiences, whether race or ethnicity or individuals in rural communities, or we're automatically thinking about and considering what do people of a lower socioeconomic status view, what's their viewpoint, what might their experience be like. The reality is when we talk about things like authorizations, prior authorizations, capping out-of-pocket costs, other forms of step therapy, these things add up in terms of dollars, right? But the reality is one of our core audiences at RDDC is the underinsured and uninsured. And I often during presentations have to say to individuals, if you have to have a conversation with your partner, spouse, your bank account, or anyone before you make a decision about going to pick up a prescription, scheduling an appointment, or things of that nature, then more than likely you are underinsured, even if you're privileged to have coverage. So we know that with the current climate and things and challenges that we're facing in that area, because Molly highlighted some of those earlier, it's going to be key for us to keep writing those letters like Kimberly talked about earlier, having conversations with our providers. Molly even talked about filling out applications for certain benefits, because sometimes with certain programming, whether federal, state, local, or private nonprofits, people will use the excuse to cut program funding because they say enough people aren't using it. And so filling out that application is a form of advocacy. Filling out, writing letters to our local representatives, that's a form of advocacy, but also having conversations with our providers. So we're grateful that all of our advocates highlighted that tonight. So one of the things that we want to highlight too is integrating cultural competency as a normalized part of what we're talking about. So whether the healthcare providers or the other members of the care team that need continuing education credits or training, we really encourage them to keep it in there. Dr. McKinnon so beautifully highlighted for us, hey, yeah, we're in medical school for 4 years, but this is what it looks like, folks. The reality is we only spent about 2 weeks on this. And even with some changes that might be more expensive now, some of these options are electives. And so we really want to, through programs like the RDDC Fellowship, but other things, normalize people getting experience around rare diseases and getting exposure to that in rotations, whether as a healthcare provider from a physician perspective or a nurse, care coordinator, community health worker, et cetera. So we really, really, appreciate that and want to highlight that the cultural competency and humility training component is key so that people can learn to center the more vulnerable audiences and voices and normalize what that looks like. One of the other key things that was highlighted over and over again, and you see it on our great graphic here, is centered around getting off-label treatments covered and more FDA-approved treatments as well. The reality is for about 95% of individuals that live with a rare condition, that percentage does not have an FDA-approved treatment. And part of that because for certain components, the clinical trials don't necessarily exist. There aren't necessarily enough individuals living with certain conditions for money to be invested into it. And that's how certain people look at it from a certain component. So it's important to understand that a lot of our rare warriors and champions are out here doing homeopathic, natural approaches and remedies. And that's what's saving their lives. And they're doing that in partnership with guidance from their healthcare providers because there is no FDA medical, like clinical, pharmaceutical treatment for them. So that's something to keep in mind as well. All right. So we want to ask our lovely Vasculitis Foundation representative, based on just some of the few things that we've shared so far, Emily, what are your thoughts on how expanding coverage for diverse treatment approaches can make a difference with patients living with vasculitis or other rare conditions?
Yeah, so 25 years ago, if you had vasculitis, your options were pretty limited. So mostly steroids or chemo drugs, and anyone who's been on steroids, which I'm sure everyone has, know the side effects are absolutely brutal. But we've come a long way in the past 25 years. So there are so many new treatment options now that can really change the game for patients. But having those options doesn't matter if patients can't access them. And that's where insurance coverage can really come in. So when we expand coverage, a few important things will happen. One, first, doctors can actually personalize treatment. They're not stuck prescribing what insurances will pay for. They can choose what's right for that specific type of vasculitis for that specific patient. And that means we can get people off those high dose steroid doses as well and make sure they're put on the right treatment for them. So second, we break down those geographical walls. You talked a little bit about the telehealth, but right now, if you live in a rural area and the nearest vasculitis center is 3 states away, that's a real problem. You almost have a choice between traveling or possibly compromising your level of care based on your doctor and if they fully understand this disease. And not everyone has the financial means to make that decision. So they're stuck with having to go to someone who maybe is not very educated in vasculitis. And not everyone has, but with that expanded telehealth coverage, suddenly your zip code doesn't determine your care anymore. You can really build a relationship with a specialist who really gets vasculitis, who you trust, without having to drive hours away to compromise your care. So, at the end of the day, expanding coverage isn't just some luxury. It's how we can give patients their lives back. It can move us toward a more equitable care outcomes for everyone when doctors can make treatment decisions based on what's clinically right and not what insurance companies can cover. So, and everybody wins, but more importantly, lives will be saved if we can do that.
Thanks, Emily. I love that you highlighted that because it's so key just when you're talking about normalizing the conversation around expanding coverage and not looking at it as a luxury. The truth is, I believe it was Caleb and a couple of our other great warriors that served on the steering committee highlighted that the telehealth component is key because it really does give you access in a different way. And it allows you to be able to connect with doctors without simple things like breaking the bank, that travel cost and things of that nature, and setting that up can be very, very taxing on a family or an individual. And so it's super important to note that this is something that's so necessary for individuals as a whole across the rare disease space and healthcare at large to help minimize more challenges and barriers erupting during their journey or odyssey, but also just in terms of giving them general access and better quality of life. It will make a huge difference. And so that's something that we're certainly working on with things like the HERD Act at RDDC to ensure that equity is still top of mind, regardless of what's going on with the current climate. So some of the additional recommendations that we want to highlight that are in the report that you'll see when you review it at your own leisure is talking about how we emphasize the fact that patient-provider partnership and collaboration are so key. So you've heard Dr. McKinnon speak of that, and you've heard some of our patient advocates speak of that as well, emphasizing that relationship, not even just in terms of the provider again, but the entire care team. It's important for providers to be compassionate listeners. It's important for individuals to have those considerations in mind and to ask questions, avoiding phrases and things of that nature like, oh, I'm just following the guidelines, or even people saying things like, I don't see color. Those are some of the things that we hear that can create additional barriers with individuals. But you should see color because it's very important in this country. And it's very important from a perspective of, let me get insight into this person's experience, because nobody's a monolith. And it's important to understand what their unique experience has been, whether it's with this condition or another circumstance. We want to highlight the power of the patient and caregiver voices in research, really centering that, like we aim to do with this project and so many others. So many of our great partners do this as well, like the Vasculitis Foundations and others. Centering the voice of the patient and the caregiver are going to be key to make sure that we're getting the most accurate and relevant information to connect with individuals about certain conditions. And of course, we cannot forget that highlighting that piece about mental health is absolutely going to be key. Creating more mental health resources for individuals, more support networks. I believe that you personally can never have too many support networks as it relates to peer support, because it does just make a huge difference in a journey. And you sometimes have individuals that might struggle with going to a doctor or provider. And you might have individuals that I've seen in healthcare all these years that struggle with going to a therapist, but they'll go to a peer support network. They'll go to a peer group. We see that repeatedly. And so that's why these networks are so important. We tell people, do both, do it all, do as much as you can or are willing to and are comfortable to. But it's important that you understand that no matter what it is, whether it's your doctor, your provider, or other your therapist, it's important to know that it's a shared decision making component where this is a partnership. You all work for each other and are supporting each other and making sure that everyone has the right information. The next part that we want to highlight is just the need that you've heard us talk about as well, expanding the academic and community awareness in the provider community, encouraging people impacted to advocate for better care. Now, the reality is everyone's not going to be Kimberly, Molly, Caleb, Betsy, or some of our other friends serve on a committee. They're not going to speak on a webinar. They're not going to stand on a stage and tell their story, but that's okay. We highlighted earlier that whether you're writing that letter, sending that email, making that phone call, it's different ways to advocate. And so in the way that you're comfortable, it's important to realize that your voice and story does matter and that you do that in your own way, in your own community or network. So your voice really does equal your power. Embracing advocacy as an honorable clinical tool is how you can ensure a great way of life. And I use the term honorable intentionally because sometimes culturally, people see everything as doctor knows best. For some cultures, it's the doctor is next to God. And I'm not going to question the provider because I feel like it's disrespectful or dishonorable. So it's important to know, again, to approach things from that partnership perspective and look at it as they're here to help me and to support me. I'm here to support them and give them information to make sure that I have the best quality of life because my voice matters and my opinions matter. So whether it's your care in the doctor's office, policy, or research, know that you absolutely, as an individual living with vasculitis or as a caregiver supporting someone impacted by vasculitis, your voice matters, and that you have something to contribute to the conversation, to the world of advocacy. It really does make a huge difference when you talk about having people give insight based on their lived experience every single day. All right. So as we prepare to close out, I want to say one last thing. People will ask like, hey, what can you do in general to support individuals, that are living with vasculitis or other rare conditions? And it's simple, but it's complex at the same time. The first thing we always encourage individuals to do is to listen. We address isms, not ignoring them and acting like they don't exist. We encourage and support. We help others navigate the system, and that's sometimes just being a listening ear, sometimes having a conversation. We mentor and we show up. And by doing all of these things, we advocate. So I'm going to ask some of our friends tonight as we prepare to close out, what can we do to support people living with vasculitis and other rare conditions? So we'll start with Molly. Just give us like a 1 minute, 30-second response of how can we support people living with vasculitis?
Trust that when they say they can't do something, that is really true. And it is so hard to say that. And you know, I tried at the beginning of my journey, I tried to push through and just pretend like I could still do the things that I used to do. Now I've gotten to the point where I'm learning to accept this, that I don't have control over sometimes what my body is telling me. So if I am too tired, if I'm hurting too much to do something, and I say that to someone, that I really mean it. You know, it's because a lot of people will assume, or some people assume, that you're just, you know, being lazy, or trying to get sympathy or something like that. That's a very frustrating situation. So anyway, but
Oh,
yeah,
thank you
just
for
trust.
highlighting that. Thank
Yeah.
you. That's a really key one, right? Just trusting the individual that you're connected to, trusting what they say about what they feel they're experiencing at that time. All disabilities are not visible. And that's one of the key things that we need to understand and highlight and consider as we move forward. And some of it isn't chronic or ongoing. Some of it might just be intermittent. I might be fine today. I might need wheelchair assistance tomorrow. It looks very different depending on the individual. So it's important to trust them for sure. Caleb, would you please provide some insight into what your thoughts are on what we can do to support people living with vasculitis?
Yes, and thank you for not making me go after Kimberly. I would just say for this one, I think just keep listening to people's stories. I know it can be very taxing with some of the um, you know, some people's stories can be very just taxing on people. So keep listening. I think that's how we learn. That's how we make change, is just listening to people's stories, listening to their struggles, and then helping them through, and hopefully learning from them, their struggles, to make better changes in the future.
Thank you, Caleb. So impactful, so powerful. Kimberly,
Thank you. And Caleb, you're awesome too. You and Molly, stop that. I would say it's kind of almost what Caleb said. The most important thing that I want to always do is just make sure that we're there for them, that they don't feel alone, and follow up on them. There was someone, that I was at the American Heart Association. They had me speaking about Behçet's as it affects the heart for one of their walks. And afterwards, I met a lady, and her daughter was going through the journey, and she was just starting. But just the fact that she heard that someone else heard that, so that that aloneness, as we talked about, we got to be there for them in any way we can, even if it's just a listen, like Caleb said. And then the other thing is follow back up with them. I not only got them hooked up with my provider, but I followed up with that mom and that daughter. Don't just do it one time. That's what I love about this space. And the vasculitis is how I got to you. So we all connect, and I have some lupus people that are on here from Wisconsin tonight. We all connect and support one another.
there are definitely intersections when you talk about the rare disease community, the chronic illness, autoimmune community. There's a lot of crossover there. I myself am not living rare, but I do live with an autoimmune condition, and there are just so many connections and similarities that you see when you hear an individual's journey and everything in between. Thank you all for sharing those insights. And what I love about what each of you shared is that these are small things that we can do every single day to show up for people. It's not necessarily, you're not always asking someone to like pay a bill or can you take me to the doctor. Sometimes it's just let's have a conversation. Can you be a sounding board? Can you be a listening ear while I struggle with this? Can you go to the doctor with me just to be another listening ear in the room? Because sometimes it can be, as some of our friends highlighted early on in the chat engagement, it can be overwhelming, and that's a valid place to be and feel during this journey. So as some of our final reflections, we'd like to highlight that, patients and caregivers are the heartbeat of this rare disease journey. You heard me say that earlier, but it's important that we keep repeating that as a way to understand why it's so important for us to engage. Just make sure that you're honoring, that you're uplifting and listening to their patients. Now, what's funny is that Molly, Caleb, and Kimberly just said this, but we're re-emphasizing it once more. And seek resources from trusted organizations such as the Vasculitis Foundation and others, right? To ensure that you're making sure that you're getting the correct resources, are maximizing the resources that you need. You are not alone. You do have a community, whether it's through the Vasculitis Foundation or the Rare Disease Diversity Coalition. We're here to make sure that individuals have get connected to the right resources and that they get connected to the right advocates that can help provide guidance along the journey. But we also honor the fact that each individual's journey is different and that it's important that we come to a connect. So as we come to a close, I just want to see, are there any final reflections that our advocates have today? Kimberly, I'd like you to go first. And as she's preparing to speak, we'd love to hear from our audience and our team members. Please share with us what's one takeaway that you're leaving with today as you prepare to go and read this 20+ page report. What are some tidbits or talking points or highlights that you'd love to share? And then we'll get into questions shortly.
Yeah, hi. Thanks, Jocelyn. My final reflection would be, again, I cannot thank Dr. Kathy McKinnon. You just remind me so much of the as I say, my superhero team that I finally have. I can't stress enough, as they said, it's so important for once you get your dream team doctors that they communicate. That's one thing why some people say, oh, you look so good. And Jocelyn and them know part of my advocacy, believe it or not, is I am a pageant queen for a natural pageant, and I use every platform to talk about all this. So I don't look like this because I just look like this. My providers talk; they work together. If something's going on with me, they're all together talking. And I love that because it makes my treatment so much better. Literally, the last time I was in the hospital was probably 2 years ago. When I first started this journey, I was always hospitalized. So it's so important that their providers communicate. And two, hook up with that support system, that support team. I can't express to you how much this has changed me having groups like this to talk to. And then number three, get your whatever mental help you need, whether it's self-care, whatever, get it, because it's worth it. Through this journey, you're going to have those times of depression where you don't want to get out the bed. And I love the fact that they talked about telehealth. I don't know if Jocelyn and them realized, but and I think we did talk about it a little bit, but I wanted to bring it out. It not only helps financially, but guess what? There's days when I can't get out the bed. I can't move. And so I still really need to connect with my doctors. So it's important that if they're in another state, that I still be able to get to them. So thank you.
No, thank you for highlighting
And I
that.
just thank you, Jocelyn, and the Vasculitis, Emily, everybody, and my new family, Caleb and Molly, and everyone.
Thank you so much. No, we appreciate you.
And thank every one of my supporters who are on here too.
Absolutely. Thanks everybody that's showing up and showing out by being here tonight. Molly, what are your thoughts and your final thoughts or reflections in terms of, how people can show up to support, any final reflections?
So just in my personal journey, you wouldn't expect this, but I am more positive and hopeful about the future than I have been probably in my whole life. And I know that sounds crazy, but just like looking for opportunities to grow as a person, to get to know who you are, what your values are, and how to show up for those core values. You only have so much energy. They call the spoons thing. And you only have so much that you can offer. So it allows you this opportunity to hone in on what really, really matters to you so that you can give all your energy to those things and then cut out the rest that doesn't mean a lot, that doesn't need to be there. It's a kind of a trial by fire thing, or purification kind of thing. I also have faith too, so that is a huge part of why I can do this. And I'm so grateful to be a part of this community and have this opportunity to meet you all. And you're just amazing warriors, all of you. So thanks.
Awesome. Dr. McKinnon, want to hear your final thoughts in terms of reflections as we prepare to close out.
Um, One thing I want to say, and I think that I realize it more and more the longer I've been a vasculitis doctor, is that I think when we come out of medical school, we learn a lot about talking to patients, and I don't think we learn enough about listening. And over the years, I realize that sometimes I don't ask the right questions. And maybe because I'm spending so much time talking, patients don't get a chance to tell me what's really important to them. And I think as I have learned this, I've learned more to ask patients, you know, why do you think that things are not going well? What's really the thing that's bothering you the most right now? Instead of just going to the lab tests and the CAT scans and things like that. So, really, until we get to be better listeners as doctors, I would encourage anybody who's a patient to be that advocate. And if your doctor doesn't ask you about the things that are really troubling you, just say, just 1 minute, doc, there's some things that I really need to talk about today. Can we talk about this? The other thing to the caregivers or the support people, same thing is to ask the patient what they need from you. And I think about in some cases when I have a couple come in and the spouse of the patient tells me they stay in too much. I think they need to get out, do more. I try to bring them out, and patient is absolutely exhausted. And what they really need to do more is rest. I think again, it's communication. And as doctors, we need to listen more. And I think as the support system for patients, we need to ask more what they need.
Thank you, Dr. McKinnon. Miss Emily, we'd love to get your insight and final reflections as we prepare to close out.
Yeah, one, I just want to thank this whole group. When reading the report, which everyone will get to read, it's things that we hear. I've heard from the last 2 years I've been at the VF of things that the patients are saying and issues that we need to address. And so it's like you took this idea and put it down on paper with so many resources for not only the patient, but their loved ones who are trying to walk alongside them. I think the last thing I'll say is there should never be a patient who feels that they are in this alone. I believe the rare disease community is the loudest, most supportive group of individuals. And there are so many resources and groups that you can plug into. You shouldn't ever feel like you're alone. So if you do feel like you are navigating this alone and no one understands, plug into a support group, find a different doctor if that's the answer, but you shouldn't have to walk through this by yourself.
Thank you so much, Emily. And just want to call out that our project manager, Taylor, has dropped in the link to this report, but you can also scan the QR code on your phone and take a look at it at your leisure. We encourage you to go ahead, utilize that link, bookmark it as a favorite, and then take a look at it later when you have an opportunity. You'll get deeper insight, personal quotes, as well as all of the recommendations that we've highlighted tonight and more from the great individuals that participated in our Health Equity Steering Committee. We'd also like to call out Mr. Caleb to provide his final reflections as we prepare to close out.
Yeah, I'll just say I'm grateful that we have this space to talk. I mean, there's people from, I think, other countries that I saw on here, and then there's people from all over the US. So I think it's really great that we live in a time where we can all just connect like this virtually, and we have all this technology to stay connected. And we've talked about the support groups. I just think as many bad things that can come out of the technology and social media world right now, there's so many great things, and I think this is just an example of that. So I'm grateful that we have the ability to speak like this, and everybody's all over the place.
Thank you so much to each and every one of you. I honor you, Caleb, Molly, Kimberly, Emily, Dr. McKinnon, for coming here to share your perspective, to share your experiences, the vulnerability, courage, and transparency that it takes to tell your story. Sometimes it's exhausting, especially when you're telling it all the time, when you feel like you're the only advocate in the room that's really raising the horn, as it relates to your cause. But this entire community has your back. I want to commend each caregiver and village team member, because I always say adults need villages too. The adults and the adult village members that are on here supporting every person living with vasculitis or another rare condition or chronic illness. We commend and honor you, and thank you for showing up and being here this evening as well. We do encourage you to go ahead and download and access this report. It also comes with, at this web page that you'll see, is a social media toolkit that provides graphics as well as sample copy and wording already ready for you to just copy and paste into your social media to help lead people to this report, to help guide people to this information so they can, again, normalize the conversations around this. Again, everyone won't get on a stage, everyone won't, have a TEDx talk. That's okay. Sometimes it's just having a conversation within your own household and community, your own church, your own community center or civic center, whatever that might be, connecting with one friend. It all makes a difference, and there's no act or deed that is too small. So we absolutely want to make sure that we, give space for that. We also want to highlight very quickly just one other upcoming event that we have where we're taught that you all might want to participate in. And you can also follow us on our socials for RDDC to get more information about this. But we're hosting a Navigating the Holidays and Health webinar on December 4th, where we're going to be talking about, special needs and dietary restrictions and how people can just learn to manage well, but also set boundaries with individuals they're connected to. And so we really encourage you to join us for that as well. So here's the sheet again for you to get that QR code, and Taylor has dropped the link in the chat for everyone to participate in. We want to check in with Taylor really quickly to see, are there any comments in the chat? What would you like to share, my dear?
Hi, yeah, just real quick, Mary asked what our plan is with the recordings. If you could share that with everyone, that would be great.
Sure. So normally what we do is get the recordings to our marketing team, and at some point they'll go live on our YouTube page, Rare Disease Diversity Coalition. But we also tend to highlight this in our newsletter as well. So once everything's done and edited, we'll make sure that it gets into our newsletter as a highlight. And so we encourage you to visit the Rare Disease Diversity Coalition website in an effort to get access to that via the newsletter or the YouTube page. So thanks so much for that. All right. And Kimberly.
Yes, I'm sorry. She answered one of them, but someone else wanted to know, is that also how, if they wanted to get a hold of you and Dr. McKinnon to do a presentation or anything like that, how would they contact you that way through this website?
Sure, you absolutely can. I'll go ahead and drop my contact information in the chat so that we can connect with you if anyone's interested about doing a presentation on either the vasculitis information or also just our rare disease inequities report that we have at RDDC. We'd be more than excited to consider connecting with you or partnering with your organization for more information. I know some of the other advocates that were comfortable doing so have dropped their contact information in the chat. And so we definitely encourage you to do that if you want to reach out to us about anything in the near future. All righty. So we appreciate each and every one of you being here today. Again, we honor you and thank you for your time. We thank you for showing up, for your willingness to participate in this project in the first place, for all of those that decided to do so. And we also just thank you for the advocacy that you're doing when there are no cameras and no microphones, because we know that this is an everyday journey and that sometimes it is a thankless labor of love. So we appreciate each and every one of our panelists tonight. Thank you so much for being here and for taking time out of your busy schedules to show up. And we appreciate each and every one of their supporters. We do want to just take about 2 minutes to answer any questions. And I do know that it was a question in the chat earlier that I want to honor and bring to the floor. Perhaps Dr. McKinnon can help us as we prepare to close out. I'm going to stop sharing. But the question was centered around, Dr. McKinnon, do you think there has been a spike in vasculitis diagnoses since COVID?
I think there's been an increase in inflammatory diseases since COVID, and vasculitis would be one of them. I do think that the strong immune response that, especially the infection generates, did awaken probably autoimmune diseases like vasculitis that were lying dormant before the infection.
Sure. Thank you so much for addressing that, because I wanted to make sure that I brought that that question to the forefront since someone was so kind to ask in the chat. We appreciate each and every one of you. Again, please check out those links, read the report a little by little at your leisure. There are some great quotes and insights from each of our patient advocates that served on the steering committee, even some that weren't able to join us tonight. They are still featured in that work, and we really encourage you to provide any insights, any feedback, so that as we move forward and working with more rare disease states, we're able to create similar types of projects and information around different diseases and conditions. We thank you so much for being here. We want to encourage you to keep up the great work that you're doing in advocacy and support. And please let us know if you have any questions by reaching out to us via email and visiting us at Rare Disease Diversity Coalition. We appreciate you and have a great night.